Hi, my name is Daniel Bay. I'm a dentist working in Massachusetts. I've noticed that there are a group of patients who have excellent oral hygiene and yet they have tooth sensitivity. They do a fabulous job brushing and flossing twice a day, and whenever they go to the dentist, they have nothing more than a regular checkup and a cleaning. Yet, there are times when their teeth become sensitive and they tend to stay away from cold items. If this sounds like you, perhaps this video is for you. These type of sensitivity are mostly due to gum recession that have exposed root surfaces. Tooth sensitivity is due to the exposure of tooth's inner layer. Have a look at this picture. The inner layer, which we call dentin, is protected. On the top, it is covered by this white outer layer, and on the roots, it is covered by cementum, which is outlined in blue. The outer layer on the root surfaces is much weaker, but thankfully they're covered by your gums. If the gum recedes, it will expose the root surfaces, and once they're exposed, the outer layer is much more vulnerable to thinning and wearing away. And if it does wear away, the inner layer will be exposed. The inner layer has channels that are connected to the pulp, which has the nerve endings. With temperature changes such as when you're eating or drinking something cold, the exposed inner layer can lead to cold sensitivity, and at times it can even be painful. Knowing this, the real important question is, what can we do about it? The first thing to do is to check your brushing technique. I realize that patients tend to be a bit too aggressive when they brush. Imagine if we had to use a toothbrush to clean our face twice every single day. You will be very gentle not to irritate it. Your gums are soft tissues as well. If you're brushing as you are scrubbing something, I would say you're brushing too hard. If you notice that your toothbrushes are bending too quickly, this may also be an indication that you're brushing too aggressively. And very importantly, you should never go back and forth when you brush. The back and forth movements are very abrasive to your gums. Let me show you how to brush with the proper technique. Alright, first thing you have to do is that you have to use an extra soft bristle toothbrush. This is very important. So this is your upper teeth, and what we're gonna do is you never want to work with the upper and lower together. You always want to work separately. We'll start with the back side. So you'll be entering like so, and then you will angle 45 degrees upwards like this. And you will lay it on the side of the tooth, do a circular motion and flick down. You want to do a circular motion and flick down. It's important, let's say you want to move to the next 2 or 3 teeth. You want to completely dislocate from the tooth and move down 2 to 3 teeth, and then do a circular motion, and then you want to flick down. Circular motion, you flick down. Let's say you want to do the inner surface like so. You'll be entering like this, and then point 45 degrees angle into the side of the tooth, 45 degrees angle and flick down, 45 degrees and then flick down. You lift it up, next 2 teeth, circular motion to flick down. If you want to work on the front teeth like this, you do the same thing. What you do is you angle it 45 degrees up, and then you flick down. You want to do 45 degrees like so, and then flick down. Likewise, you want to do circular motion like this and flick up, do circular motion and flick down. The only time you want to go back and forth is actually if you're on the top of the tooth and you want to do this. Make sure you don't press so hard that it touches the gum like this. You want to lightly place it on it and then go back and forth like this. Now let's pretend this is the bottom tooth by turning it like this. And now you'll be entering, and you angle it 45 degrees down now. So you lay it on the side of the tooth, circular motion, flick up, circular motion and flick up. Likewise, if you want to do the inside, you go like this, 45 degrees down, circular motion, flick up, circular motion, flick up. Remember never to go back and forth on the side, right? So you want to lift completely off the tooth and want to work on the next 2 teeth, do circular motion and flick up, circular motion and flick up. Likewise for anterior or the front part, you do circular motion like so and flick up, circular motion like this, circular motion like this, flick up, circular motion and flick up. The only time you go back and forth is if you're on the top. Make sure not to press too much that you touch your gums like that. Lightly place on it so that you don't touch your gums, and then go back and forth like that. Alright, that's about it. This technique will allow you to be gentler with your gums and to be less abrasive against the outer layer protecting your dentin, which is especially important if root exposure is already present. Next step is to use toothpaste that will help with sensitivity. Toothpaste have desensitizing agent, and these common agents are potassium nitrate, strontium fluoride, and strontium chloride. Potassium works on nerve endings. Fluoride and strontium work by physically clogging up the channels of the inner layer. It takes a bit of time for these toothpastes to work, so don't be discouraged if there's no improvement after a few days. Use them for at least a few weeks and see how it goes. In many cases, the proper brushing technique and the toothpaste with desensitizing agent will help with tooth sensitivity. However, if they persist, there are other measures we can take in a dental office. Your dentist will need to evaluate you, but some treatments include higher concentration fluoride application, bonding where we cover the exposed inner layer with dental material, or soft tissue grafts that can recover receded gum lines. Alright, that wraps up my video. I hope that this video was helpful. I'm a big fan of ice cream myself, and I would be devastated if I had to refrain from it due to tooth sensitivity. Thank you so much for watching. If you have any questions, please leave them in the comment box below. Please subscribe to the channel and follow me on Instagram. See you soon.